Now, the BRCA1 and BRCA2 question is really quite a interesting question, and I don't think we've touched on it much before. There's a big deal about it, and it turns out that about 3% of women with breast CFCs and about 10% of women with ovarian CFCs have the BRCA. The BRCA stands for breast cancer, and they call them 1 and 2. And what they are really, they're not genes for producing CFCs. They are part of an entire enzymatic group of enzyme systems that repair double-stranded DNA, which gets broken up during the process of cell division, when cells are growing and multiplying. And so we have mechanisms in place, and that's just one of them. And if you have just one of them, if you have just a BRCA1 or a BRCA2 that you inherited from one of your parents, but you still have the other chromosome from the other parent that doesn't have it, then you're not full on. It's kind of like having a sickle cell trait, but you don't have the full thing. If you got it from both parents, you're in big trouble, right? Now, but here's the thing about these BRCAs, and I just met. This was such a. I know you're probably watching, and I'm not going to, of course, mention your name, of course, but I mean, and I feel so sad because you found out that you were BRCA1 because you had a mother, an aunt, and a cousin who had ovarian, and although the mother and the aunt had not been tested at all, the cousin was, and then you got tested and you found out you had BRCA1. And they convinced you out of fear to have your uterus, ovaries, and both breasts removed, right? And I think we discussed it. But if you realize that if you follow the reasoning or you follow the advice of the conventional world, they're going to tell you that you're also at risk for fallopian tube CFCs and all different kinds of peritoneal CFCs and colon CFCs and pancreatic CFCs. So clearly, you can't remove all of that stuff. And then, what happened to this poor person, I'm not mentioning your name, of course, is that about a year after the removal of the ovaries and the uterus, this person developed ovarian CFC anyway. And so you might ask, well, what? Well, that's it. It was caused by the BRCAs. Well, was it? How do you know? And I want you to think about this. Suppose I have a BRCA, or a woman has a BRCA, and she gets breast CFCs. Well, we already know that 95 to 97% of the women who get breast CFCs don't have BRCA. So how do we know that woman who got it and has BRCA got it because of the BRCA or got it because of whatever the other reasons were? You don't know. You don't know.